In Australia, a simple test you can do at home could save your life, but many people in Nepali-speaking communities aren't using it. Today we're diving into bowel cancer awareness, specifically what every person aged 45 and over needs to know about free screening, the warning signs you shouldn't ignore, and how early detection can mean the difference between life and death. By the end of this episode, you'll understand exactly how to access Australia's free screening program and feel confident talking to your doctor about symptoms that matter. Let me bring in our expert to break this down.
This information comes directly from Dr. Lakshmi Prasad Dakal, a senior physician with incredible credentials. He completed his MBBS from Teaching Hospital in Kathmandu, then earned his MD in Geriatric Medicine and MPH in Health Economics from the Netherlands. Dr. Dakal is a Fellow of the Royal Australasian College of Physicians, teaches at the University of Melbourne, and works as a clinical director at a Victorian government hospital. He's also the founder of the Punya Foundation.
And this project is funded by the Australian government through Cancer Australia's Supporting People with Cancer grant program, specifically targeting Nepali-speaking immigrant communities in Australia.
So let's start with the basics. Bowel cancer affects the final part of our intestines, what we call the colon and rectum in English. It's where bad cells start growing abnormally and don't stop.
And the key thing here is early detection, right? If caught early, this cancer can be treated successfully and even cured.
Exactly. That's why Dr. Dakal emphasizes awareness so strongly. The earlier we catch it, the better the treatment outcomes. But first, people need to understand their risk factors.
What puts someone at higher risk? I imagine age is a factor.
Age is huge, especially after 45. But there are other factors too. Family history is important. If your parents, siblings, or close relatives had bowel cancer, your risk increases.
What about lifestyle factors?
Diet plays a big role. High meat consumption combined with low intake of fruits, vegetables, and whole grains increases risk. Being overweight, lack of exercise, excessive alcohol, and smoking all contribute too.
And there are some medical conditions that increase risk as well?
Yes, long-term bowel diseases like Crohn's disease or ulcerative colitis can increase risk. But here's what's important. Dr. Dakal notes that anyone can get bowel cancer, regardless of gender or age, though risk does increase with age.
So what should people be watching for? What are the warning signs?
This is tricky because early-stage bowel cancer often has no clear symptoms, and we often ignore small signs or just endure them, which means cancer symptoms can easily be missed.
That's concerning. What specific signs shouldn't be ignored?
Blood in stool is a major one, whether you see it directly or notice it on tissue paper. Changes in bowel habits are important too. Frequent loose stools, diarrhea, or alternating between diarrhea and constipation. The intestine is like a pipe. When cancer develops, it narrows the pipe, so stools can become thin, like a pencil. Abdominal pain or cramping is another sign.
Are there other symptoms people might not connect to bowel cancer?
Feeling like you haven't completely emptied your bowels after going to the toilet. Unexplained weight loss. Unusual fatigue and weakness. Dr. Dakal emphasizes these symptoms need attention.
But having these symptoms doesn't automatically mean cancer, right?
Absolutely right. Dr. Dakal specifically says these symptoms don't necessarily mean cancer, but they do mean testing is necessary. That's the key distinction.
Now, let's talk about Australia's screening program. How does it actually work?
Australia has a free bowel cancer screening service. The government sends free screening kits by mail to most people aged 50 to 74 every 2 years. People aged 45 to 49 can request a free kit.
Wait, they just mail it to your house? That's incredibly convenient.
Exactly. And you can do the test at home easily. They've even created a short video to make it simple to understand. The process is straightforward.
Walk me through what someone actually has to do.
You use a small stick from the screening kit to take a tiny stool sample. Put that sample in the tube provided in the kit, then mail it back using the envelope that comes with the kit.
That does sound simple, but what exactly is this test looking for?
Dr. Dakal explains it brilliantly. Bowel cancer is like having a wound. Wounds bleed, but in early cancer, the wound is small, so only a little blood flows. The test can detect tiny amounts of blood invisible to the naked eye.
So it's essentially looking for hidden bleeding that we can't see ourselves.
Exactly. And that's why timely testing is so important. It catches the disease early when treatment outcomes are much better.
What happens if someone gets a positive result? Should they panic?
No panic needed. A positive result doesn't confirm cancer because there are many reasons for blood in stool, but it does mean your GP should recommend further testing.
That's reassuring. But what if someone has symptoms? Should they wait for their screening kit?
Absolutely not. Dr. Dakal strongly emphasizes this. If you see blood in your stool, your bowel habits suddenly change, or you have abdominal pain, don't wait.
But I imagine some people feel embarrassed talking about these issues with their doctor.
Dr. Dakal addresses this directly. He says, don't be ashamed to see a doctor. Don't hide problems. Doctors and nurses talk about bowel movements, urine, and similar topics every day in their profession.
That's such an important point. It normalizes what feels like an awkward conversation.
Exactly. You should consult your GP as soon as possible. You can speak comfortably about your problem, saying things like, I've noticed blood in my stool, or my bowel habits have changed significantly.
And if someone feels uncomfortable going alone?
You can bring a family member or someone you know to the doctor with you. You can ask the doctor questions without hesitation.
What happens after the GP visit if cancer is suspected?
After testing, if there are signs of possible bowel cancer, the GP will refer you to a cancer clinic for further investigation. Australia has cancer treatment teams with specialist doctors, surgeons, nurses, and therapists.
And the cost? That's often a major concern for immigrant communities.
In Australian government hospitals, cancer services are free for residents. That removes a huge barrier to getting proper care.
What about language barriers? Not everyone in the Nepali community is comfortable with medical English.
If you can't speak English well or feel the language isn't sufficient for such a sensitive topic, you should use interpreter services. Australian law gives you the right to receive information about your illness and ask questions.
Are there other support services available?
Yes, organizations like Cancer Council provide cancer-related services where you can get information and support.
Let's step back and look at the bigger picture here. What are the key takeaways people need to remember?
Dr. Dakal's main messages are clear. Bowel cancer can happen to anyone. If you're aged 45 to 74, use the free screening materials that come to your home or that you can request. Pay attention to symptoms, blood in stool, changes in bowel habits, abdominal pain, weight loss, excessive fatigue. If you see these symptoms, consult a doctor.
And don't let embarrassment or language barriers stop you from getting help.
Exactly. If you need help or have language problems, speak openly with the various available cancer services. Remember, early detection means successful and easier treatment.
Dr. Dakal makes such an important point about embarrassment. Talking about bowel movements might feel strange or embarrassing, but having these open conversations could save your life.
That's the heart of it. And he encourages people to share this message with family, neighbors, and friends. Community awareness saves lives.
You know what strikes me about Australia's approach? Mailing free screening kits removes so many barriers: cost, transportation, even remembering to book appointments. It's healthcare that comes to you.
And the science behind it is fascinating. We're essentially looking for invisible blood. Cancer creates tiny wounds that bleed in amounts our eyes can't detect, but tests can catch. It's early detection at its finest.
So when you step back from all this, here's what it comes down to. We have the tools, we have the knowledge, and we have free access to potentially life-saving screening. The only barrier left is awareness and action.
Exactly. Dr. Dakal's expertise, combined with Australia's comprehensive support system, creates an environment where early detection and successful treatment are absolutely achievable, but only if people use these resources.
The message is clear. Don't wait, don't be embarrassed, and don't let language barriers stop you. Your life could literally depend on having that conversation with your doctor. Thanks for joining us on Copilot Podcasts. Remember, that free screening kit sitting in your mailbox isn't just mail. It's a potentially life-saving opportunity that takes 5 minutes to use. Don't let it sit there.